According to a new study, which came out of Norway, people who wore face masks were actually found to be more likely to contract COVID versus people who did not wear face masks. Specifically, this peer-reviewed study right here, it was published in the pages of a journal called Epidemiology and Infection. And in this study, these Norwegian researchers were analyzing the mask usage of a little over 3,200 people in their country. And once an individual signed up for the study, they were followed for a period of about 17 days, and then subsequently they were asked about their personal usage of masks. And what these researchers found was that there was a higher incidence of being tested positive for COVID among the people who wore masks more frequently. In fact, according to the data, among the people who never or almost never wore masks, 8.6% of them tested positive for COVID. Among people who sometimes use masks, that number rose to 15%. And then, among the people who either almost always or always wore masks, 15.1% of them tested positive for COVID. Now, when these researchers went back, crunched the numbers, and adjusted the data based on several different factors, such as vaccination status, sex, gender, and so on, they found that, quote, individuals who sometimes or often wore masks had a 33% higher incidence of COVID-19 compared to those who never or almost never wore masks. This jumped up to 40% among people who almost always or always wore them, which is a wild finding. People who almost always or always wore masks were 40% more likely to catch COVID versus people who never wore masks at all. Although the researchers then went on to write that when they adjusted again for something that they call baseline risk over time, the number shrinked further. Quote, using second-degree fractional polynomials, we fitted a model where we let time of inclusion in the study be non-linearly associated with the risk of infection, thereby modeling any differences in background risk linked to the population prevalence of infection when the participant entered the trial. With this approach, the risk of self-reported COVID-19 infection when wearing a face mask was more moderate, 1.03 times higher in those wearing face masks often or sometimes, and 1.04 times higher in those wearing face masks almost always or always than in participants having worn face masks never or almost never. Meaning, in plain English, that when you incorporate the background societal risk of COVID at the time when each participant entered the trial, well, the chance of a mask-wearing individual catching COVID shrinks to about 4%. Regardless, though, whether the risk of catching COVID was 40% higher or just 4% higher, the end result is the same. These researchers, they found that the more a person wore a mask, the more likely they were to catch COVID, which obviously goes against many of the studies which were popularized by the mainstream legacy news outlets over the past 1, 2, or 3 years. Quote, the results contradict earlier randomized and non-randomized studies of the effectiveness of mask wearing on the risk of infection. Most of these studies reported that wearing a face mask reduced the risk of COVID-19 infection. Some observational studies have reported manifold reduction in infection risk, while one community-based randomized trial failed to demonstrate a statistically significant reduction in infection risk, and one cluster randomized community trial has found only modest reduction. Which is odd that these researchers fail to mention some of the other studies that we've mentioned here in our program, which also have found that masks contribute to COVID infection. And by the way, it's worth mentioning that, just as an aside, these researchers were actually able to replicate their finding a second time. Quote, in our second pre-specified analysis, in which the sample was split according to whether face mask was mandatory for at least part of the follow-up period, there was a higher risk associated with wearing face masks in a period where there was no general recommendation on face mask use in force. Meaning, in plain English, that when they stratified the data and looked at the time periods when masks were mandatory, they found that wearing a mask when it was not mandatory was still associated with a higher incidence of catching COVID. Now, in terms of why this actually is, why is it that mask wearing appears to lead to higher incidence of catching COVID-19? Well, these researchers wrote up a number of possible guesses. Here's what they wrote. Quote, our findings may be explained by several factors. It may be that our participants were more prone to wear masks to protect others from their own infection. This reverse causality may explain the positive association between risk of infection and mask usage and could be supported by the finding that participants reported wearing masks also were more likely to test themselves for COVID-19. Furthermore, there may be other behavioral differences related to the perception of risk or occupation, which we did not observe, that are linked to the likelihood of wearing masks or being tested for COVID-19 when symptomatic. There's also the possibility that mask wearers feel somewhat protected and thus change their behaviors to not observe social distancing, so that any benefit of masking is offset by increased exposure, which are frankly all fine guesses. But notice something. all the different hypotheses that these researchers bring forth, they all make a point of not blaming the mask. They write that people who wear masks might be more susceptible to COVID to start with. Maybe once they wear a mask, they stop social distancing and start going to parties. Maybe they have certain types of jobs that are more likely to have them come into contact with COVID, and therefore wearing a mask only lower the chance by a little bit. These are all the explanations that were put forward by the researchers. However, one thing that they left out is the fact that wearing the mask might be, in and of itself, increasing a person's chance of getting infected. And in terms of why that is, Senator Rand Paul, who also happens to be a medical doctor, he recently gave an interview where he explained it quite well. Take a listen.
Even the Cochrane analysis looked at the N95 and found they didn't work very well. And there's a couple reasons for this. And I would say this with a caveat. If you're 75 years old and your spouse is sick with COVID the first time around when it was very deadly, I would have suggested, yes, wear gloves and a mask when you go in to take them food, come out, throw them away, and have a brand new pair every time you go in. That's what the doctors and nurses do. It's not foolproof, but it might work to some extent. They do know that the N95 masks, which do have small pores, after you wear them for 3 or 4 hours, the moisture of what you exhale, your exhaled air, gets rid of the electrostatic charge, and they don't filter as well. They really need this electrostatic charge. There's a lot of reasons they don't work as well. But they also know that they're so tight that everybody's fidgeting with them. So you and I shake hands, and then I was like, my damn mask is pressing on my face, and I do this. So really, I'm just probably bringing things actually to my face.
Furthermore, one other point to mention here is that if you've been following the Epoch Times for a while, then you likely know that I've done many of the ads for the paper. I've done ads for TV, for Facebook, for YouTube, and so on. And what I've learned from working on all this advertising is just how stringent America's truth in advertising laws actually are. You cannot make false claims in your advertisements, especially when it comes to health. That's why very often when you see pharmaceutical commercials on television, nearly half of the commercial is devoted to the side effects that the drug might cause. And so, starting in 2020, despite what the politicians and the people on television were saying, when I started to see boxes like these are boxes that these face masks were sold in, and they have very interesting messages on them. Messages which lay out how these masks specifically do not protect people against COVID-19. And as soon as I saw that, I knew that these masks did not do anything. Because if they did anything, if there was any plausible way to say that they reduced your chance of catching COVID by 0.1%, then the marketers behind those masks, they would plaster that fact in huge letters on the front of the box. This mask lowers your chance of catching COVID. It would say that in big letters. Of course, it would have a little asterisk with fine print telling you the percentage of protection and so on, but they would definitely write that. But instead, these little blue masks that everyone was wearing came in boxes that specifically told you that they did nothing to stop COVID. So you combine that with people fidgeting their masks, touching their face to adjust the mask, putting the mask in their pockets before pulling them out and putting them back on again. And perhaps that's the real reason behind numbers like the one in this study right here. If you'd like to go through this Norwegian study for yourself, I'll throw the link to it. It'll be down in the description box below if you happen to be the type of person who likes to dig into the weeds. And then, until next time, I'm your host, Roman from the Epoch Times. Stay informed. Most importantly, stay free.